everyone. This is Rebecca Roulier from Doc Wayne Youth Services. Thank you all for joining us today on our Champions Network webinar, Urban Youth's Mental Health Matters, Understanding the Impacts of Untreated Mental Illness and the Roles of Families and Community Leaders. Newly launched, the Champions Network, powered by Doc Wayne, provides a virtual space that includes a training portal for coaches, clinicians, and teachers to harness the power of sport to improve mental health for all. In all of our initiatives, we aim to reduce stigma and increase access for all. For this webinar today, logistically, please use the chat function to share your questions, comments, and insights. We appreciate all of the expertise that we have here on the webinar today. We will be taking questions at the end of today's webinar. So again, feel free to share your thoughts and comments, but we will be addressing questions at the end. And should we not get to your question today, you can reach us at support@docwayne.org, and there will be a follow-up email coming out from Doc Wayne at the end of the week, sharing the great materials, resources, and the recording from today. To frame today's conversation, community leaders are often the first point of contact for youth who are struggling with mental health concerns. In difficult times, youth and families turn to those who they trust the most. Within the lens of sport, as this is our work at Doc Wayne to fuse sport and therapy to heal and strengthen at-risk youth, today's topic highlights both the importance of coaches and community leaders as key players in our mental health system and the need for all to be part of the conversation around inequalities. There are 6.5 million coaches in the United States and 577,000 mental health providers who often are battling long wait lists and difficulties around insurance access and stigma. Coaches and other community leaders should feel empowered given the immense trust young people have in their relationship. And today we're going to hear from two experts in the field of mental health to build awareness and share practical skills, strategies, and guidance around assisting minority youth as a community leader. It's my great pleasure to introduce our two speakers today, Dr. Gemima St. and Dr. Vanessa Prosper. Dr. Gemima St. was recently announced as the new Associate Vice President for Workplace Initiatives and Special Training at William James College. Congratulations to her. Dr. St. also serves as an associate professor in the clinical psychology program director of the HRSA STAR Fellowship Program, and director of the Pathways Program in the Department of Community Engagement. And I'll let Gemima tell you more about her great work today, but we're so thankful that she's joining us. And Dr. Vanessa Prosper currently holds the position of clinical coordinator at Boston Latin School, where she co-runs two programs dedicated to providing emotional and academic support to students transitioning back to school after a long absence, and students whose emotional struggles are severely impacting their academic functioning. Dr. Prosper joined Boston Latin after a stint as a staff psychologist at Boston Children's Hospital Neighborhood Partnership Program. She also has a private practice in the Back Bay area of Boston and is an adjunct professor at Boston College and Lesley University. Welcome, Dr. Vanessa Prosper. We're so grateful to have both of these experts on today, and at this time, I'm going to turn it over to Dr. St.
Thank you very much, Rebecca, and good afternoon, everyone. It is a pleasure for us to be here today to engage in a conversation about mental health and the importance of addressing mental illnesses among urban youth. I have to begin by first and foremost extending my sincere gratitude to our colleagues at Darkwing Youth Services for this amazing opportunity to speak with all of you regarding a topic that is very close to our hearts as clinical psychologists who both practice in providing mental health services to urban children, adolescents, and their families. Today, we will cover a number of topics as part of this presentation. I will begin by providing an overview of the prevalence of mental illnesses among children and adolescents. And I will also focus on addressing some of the factors that have been shown to contribute to significant disparities in urban communities. Please note that throughout this presentation, I will be utilizing the terms child, adolescents, and youth interchangeably to refer to young people who are under the age of 18. Following my presentation, Dr. Prosper will focus specifically on the impacts of trauma on children and adolescents. She will also describe some culturally responsive and trauma-informed interventions, as well as share some practical guidelines and skills for addressing the mental health needs of urban youth. This is a quote that I would like to share with all of you from Nelson Mandela, which truly captures the essence of why preventing mental illness among children is a significant factor in a society's ability to demonstrate that it really cares for and can attend to the well-being of its most vulnerable citizens. Nelson Mandela was quoted as saying, "There can be no keener revelation of a society's soul than the way in which it treats its children." We know that children are a gift to our community. We know that they are the future of our society. Therefore, it is important that as concerned citizens that we take all the necessary steps, not only to identify early signs and symptoms of mental illnesses among our children, but to be proactive in ensuring that we address those needs early on in order to ensure that they will thrive, that they will have a bright future, and that they will be contributing members to a successful society. Now, I'm going to turn my attention to the prevalence of mental illnesses among children and adolescents throughout our nation. According to data that have been published by the U.S. Department of Health and Human Services, which is a branch of the federal government, 1 in 5 children has a mental disorder. This basically represents about 15 million children across our nation who are suffering with a mental health problem. We also know, based on the data, that 1 in 8 children has a co-occurring substance use or substance abuse disorder. This means that in addition to having a mental illness, these children and adolescents are also struggling with a substance abuse problem. The data further show that 1 in 10 children suffers from a severe mental illness. This may be, an example may be bipolar disorder or schizophrenia. When we look at the data for the state of Massachusetts, they're certainly representative of what's happening across the nation. About 18% of the estimated 1.4 million children who are living in the state have one or more emotional, behavioral, or developmental condition. Not surprisingly, the most commonly diagnosed conditions among children who are struggling with a mental illness are anxiety, depression, and behavioral or disruptive disorders. The data further show us that about half of all cases of mental illness begin before the age of 14. half of all cases of mental illness begin before the age of 14. And this is an important statistic to keep in mind. In most cases, about 90% of young people who do go on to develop a mental illness, there were signs, there were symptoms that manifested during their teenage years. The reason why I said these statistics are quite important, there are two factors here that I would like to underscore. One is the window of opportunity that opens up during adolescence. We know that adolescence is certainly a period when kids are going through a lot of biological changes, a lot of emotional changes, but this is the time also for us to really be mindful of the symptoms, of the signs, so that we can differentiate what is normal adolescent development versus what may be more indicative of something much more deeper going on with our young people. And the second piece is the fact that because we know about half of all cases beginning before the age of 14, this really speaks to the importance of prevention, that we have this unique opportunity to do something different, to link these young people to services early in the process so that we can put them toward a path of success down the road. So it is important for us as mental health providers that we take the step to raise awareness by educating parents, caregivers, teachers, coaches, and everyone else who's involved in caring for our children and adolescents, that we promote greater awareness on those signs and those symptoms so that they can help us link these young people to services as early as is feasible. Despite the fact that we know the sad statistics that 1 in 5 children struggles with mental illnesses in our country, when we look at issues around access and utilization of mental health services, the statistical data are even more dire. Only 1 in 5 children who actually have mental illnesses receives any kind of care. So this speaks to the fact that about 80% of children and adolescents who are struggling with a mental illness do not receive any kind of care at all. And we know that mental illnesses do not just go away. They don't just evaporate or disappear, which speaks to the importance, again, of being mindful and being, to pay attention around ensuring that we are identifying and linking these young people to services earlier rather than later. And when we look at across ethnic and racial demographic characteristics, the sadder news is that if you are an ethnic and racial minority youth, you are not only less likely to receive mental health services, but you are less likely to stay even when services have started. And we'll talk in a minute about some of the contributing factors. More likely, what we see in the case of ethnic and racial minority youth is that when they do engage in mental health care, the quality of the services that they receive tends to be less. They tend to receive services that are inappropriate, services that are fragmented, and services that are not culturally responsive to their mental health needs, which helps to explain why many ethnic and racial minority youth and their families do not remain in care for an extended period of time. So why do those disparities exist? We know certainly that children who live in communities that are exposed to trauma have a higher risk of developing mental illnesses. Yet they are less likely, as I just said a few minutes ago, to engage in services, to receive quality mental health care, and to remain in care. Some of the contributing factors include the following. Many of these young people live in high stress neighborhoods, whether they are exposed to community violence, domestic violence. We also know that socioeconomic factors play an important role here, that poverty is a significant contributor to higher rates of mental illnesses among individuals and communities that are impacted in those ways. Yet, despite the fact that we know that urban youth do live in higher stress neighborhoods, that they tend to experience systematic discrimination and racism, they tend to be more affected by poverty, they are less likely to receive the most the most qualified or most culturally competent mental health services. You may say that this is ironic in the sense that one of the most vulnerable groups in our society who have exposure to chronic poverty, to chronic racism, to chronic discrimination, these are the individuals who are less likely to be seen in mental health care, and they're least likely to receive culturally competent mental health services. Another contributing factor that has been cited in the literature is what is referred to as practitioners' implicit biases. And this means that mental health providers often view youth of color as being at higher, as demonstrating behaviors that are viewed by practitioners as being more problematic. For instance, ethnic and racial minority boys are more likely to be diagnosed with conduct disorder as opposed to attention deficit disorder, which means that more often than not, the types of referrals and follow-up services that are made for these young people look very differently than the referrals and services that are put into place for individuals who are from white European backgrounds. Moreover, what we see as contributing to these significant disparities is the lack of a culturally diverse workforce, which means that, for instance, in the field of clinical psychology, it is a field where 90% of practitioners are individuals who identify as non-Latino white, and many of whom may not have received the proper training in terms of how to provide culturally responsive services to urban youth and their families. We also see that because this is a field that is predominantly white, there's a scarcity of culturally diverse providers. So providers who look like these young people, providers who speak their languages, providers who understand the cultural context from which these young people are from, who can relate to the experiences and provide the type of culturally and linguistically appropriate services that are needed. So all of these factors taken together have contributed to persistent disparities, have contributed to a lack of access in resources that have not been implemented and put into place to ensure that our young people are accessing and utilizing mental health services. We certainly know as providers that there are significant costs when we do not attend to the mental health needs of children and adolescents. One of the ways in which we deal with untreated mental illnesses as a society is through the school system. And what we know from some data, for example, is that schools have become basically the primary mode of providing mental health services to youth. However, these school settings, if they are not equipped with culturally competent providers, they can perpetuate some of the same factors that I've discussed earlier. We see more often than not, Black and brown boys are suspended or expelled from schools because of untreated mental health issues. And we know that school suspension and expulsion have contributed to the school and to prison pipeline, because these are kids, instead of having their depression or anxiety treated, are often labeled as conduct disordered children who often end up in the school to prison pipeline. We also know that there are significant costs when children do not complete their education, when they drop out too early in school. These are kids who may face unemployment in adulthood, poverty, and homelessness. These are also young people who are at higher risk for other complicated outcomes in terms of issues around lifetime of productivity, quality of life, and physical health. If you are not familiar with the ACE study, the Adverse Childhood Experience Study, I would strongly encourage you to Google it and learn more about it, because this is one of the most compelling pieces of research that has been conducted over the past 20 years that has shown a direct link to childhood trauma in what happens in adulthood. If you are able to see the graph that I'm showing here, they track. Basically, they asked, this is a study that was conducted with over 17,000 individuals in California, where these were adults seeking seeking medical services to their primary care physicians. And they were asked to basically report the number of adverse or negative childhood experiences that they had. And what the findings showed, the more adverse childhood experiences that these individuals were exposed to, the poorer the long-term outcomes, which means that if you had 3 or 4 or 5 adverse childhood experiences, you were less likely to have graduated from high school, less likely to have gone to college, more likely to have obesity, diabetes, depression, suicide. So it is important for us as caring community members to understand that early intervention, early diagnosis, and early treatment are all equally important in ensuring, again, that we put our children on a healthier path so that we can decrease the long-term negative impacts of childhood trauma and untreated mental illnesses. As a society, mental illnesses that are untreated in childhood also cost us a lot of money. $247 billion is what we invest annually in the treatment and productivity costs due to untreated mental illness in childhood, making mental illness the most costly and the most prevalent of all chronic illnesses in childhood. So these issues, I wanted to share some of the statistical data with you to really set the stage for why it is key that we, as invested, caring adults in the lives of children and adolescents, that we be proactive and learn more about the signs and the symptoms of mental illness, and more importantly, what to do and how to link young people to appropriate services early in their development. So addressing the mental health needs of children is all of our jobs. It should be our number one priority. Whether you're a parent, a caregiver, a coach, a teacher, a young person, a community leader, a faith-based organization, this is our duty to ensure that we always underscore the importance of addressing children's mental health. I will wrap up my talk by sharing a final quote from UB Jones, who is the founder of Massachusetts Advocate for Children. And he stated, "We do not merely have a social responsibility to assure that our children and youth have decent life chances and prosper. We have a sacred obligation to do so." I will share some additional resources and also make sure that copies of this PowerPoint presentation is disseminated to all program participants. I look forward to your questions after Dr. Prosper's presentation. Thank you for your attention.
Thank you, Dr. St. Louis. I forgot to unmute myself. Just give me one little minute and to pull up my presentation. Oops. Sorry. Okay. All right. Thank you so much again, Dr. St. Louis. So I wanted to speak specifically, as Dr. St. Louis said, about trauma. I know a lot of you who are listening to this right now are coaches or mental health clinicians or have other roles in kids' lives. So just wanted to bring attention to kind of like when thinking about trauma, what are we talking about, especially in light of what's been going on in the world. And we're talking about COVID-19, of course, the pandemic and the racial unrest that has surged in this country since the month of May. And so these two things are both, a lot of people out there in the media saying kind of like also the racial unrest is a form of a pandemic as well that's been going on for years and years and years, right? And so these two things are adding on to already a baseline of trauma that some of our kids have already experienced, and those our kids who have not experienced trauma before is definitely introducing trauma in their lives. And also when we're thinking about COVID-19 and the racial unrest, it's a collective trauma that we are all living, and especially for our youth of color, more specifically. And with, if we're thinking just about COVID-19, just as an example, just to make it more concrete in terms of the stressors in our kids' lives, it's just like, if you think about pre-pandemic, those, some of our kids, or a lot of them, whatever stressors that they had to contend with in terms of their home situation, whether there was, situation where they experienced physical, verbal abuse, neglect, or even if they were witnessing domestic violence, those situations are further exacerbated because of COVID-19, because now these kids have to stay home, whereas maybe doing athletic activities or going to school was a refuge, was a safety haven away from home. Now they are stuck at home, which is further exacerbating their stressors and further making them exposed to traumatic situations, in addition to the pandemic, in addition to what the racial unrest as triggered in our kids of color, especially our Black and brown kids. And this is racial trauma as well. And so as Dr. St. Louis was talking about the adverse childhood events, in the case of an aftermath of the collective trauma of COVID-19 and racial unrest, is definitely a surge in childhood abuse, neglect, family dysfunction, family losses, and thus making our youth further vulnerable to developing PTSD and experiencing trauma. So when we're talking about trauma, what are the symptoms? And, Dr. St. Louis was talking about, like, as coaches, as parents, as teachers, as all adults around a child, the more they can be equipped with the information on how to recognize signs and symptoms that a kid might be vulnerable to a certain mental health disorder, such as depression or anxiety or trauma, the better, because you are in a position where you can support that child and make referrals, to the appropriate supports for that child. So when we're talking about trauma and PTSD, what are we talking about here? So there are three pillars of trauma, which are hypervigilance, re-experiencing, and avoidance. Anyone who experiences, as you can understand, a situation that is traumatic. And what is a situation that is traumatic? It's a situation where a person feels like their life is at risk, their life is being threatened. It's something that is perceived to be life-threatening, whether you are experiencing it yourself or you are witnessing it. So as a result of that, people who actually experience or witness trauma, they tend to be, understandably so, on high alert. It really shatters your sense of trust in the world. It shatters your sense of safety in the world. So those kids what are the behavioral manifestations of hypervigilance in kids is that they're very mistrustful of peers, of adults, of everyone around them. They get startled easily. Another form of hypervigilance is because, again, that kid who's hypervigilant is in survival mode because they have experienced something traumatic. They don't trust anything. And so they're quick to react. This is a kid who will engage in has poor impulse control. It will engage in verbal and physical fights with others very quickly. They're very agitated. They can be very disruptive in the classroom. They can engage in more aggressive behaviors, be more irritable, experience panic attacks. So as Dr. St was saying, like, you can see that if you don't have that information, how some people can quickly label these kids, in addition to their implicit bias, label these kids as being aggressive, when in reality, they are reacting, it's more a manifestation of a traumatic situation that they've experienced before. So these symptoms can be confused as somebody, a kid who has a conduct disorder or oppositional defiant disorder. Another pillar of trauma is re-experiencing, where the person will, may experience some nightmares about the trauma that they have witnessed or experienced, and experience some insomnia. Also, in a lot of kids, what we see in the classroom is that if they've experienced traumatic situations, that flashbacks, which is one I forgot to put on here, you can experience flashback of the trauma. And because of not sleeping, not being able to fall asleep or stay asleep because of your nightmares, and also because of your flashback, it's hard to focus in the classroom. It's hard to learn. It's hard to retain any information. And that's why those kids can seem to be totally disengaged in the classroom, or disengaged, on the soccer field and things like that. And also re-experiencing is like, kids who are traumatized, research shows, tend to engage in more aggressive or even sexual play. So these are warning signs to look out for. In terms of avoidance, most people, if not all people who are traumatized, understandably so, tend to avoid any situations, person, that reminds them of their trauma. So consequently, they avoid those sources. So social withdrawal can also be a symptom of trauma. If you have a kid who used to be very social and all of a sudden they're withdrawing themselves because their sense of community is shattered by the traumatic situation that they have experienced. Another form of avoidance can be suicidal ideation or attempt, and self-harm. And the reason why it's considered a form of avoidance is because unconsciously the person is using the suicidal attempt to escape the emotional turmoil that has been triggered by the trauma. Same thing for self-harm. It's a way unconsciously to really escape and avoid the emotional anguish and turmoil brought on by the trauma, and covering it with physical. You cover the physical pain of the self-harm over the emotional pain. Substance use can also be a way to escape all the thoughts, all the feelings of the trauma. It is considered a form of avoidance. So I'm just wanting to set this pace in terms of equipping you with the tools to recognize, as you're interacting with kids and and adolescents, in terms of what could be potential signs of trauma. Also, just want to quickly kind of what happens very quickly in terms of trauma, and in terms of helping us understand why is it that so you work with a lot of kids, why is it that kids experience a hard time at school if they are traumatized, especially in terms of engaging in schoolwork, in terms of paying attention in school and all of that. So very, very quickly, if you think about somebody who has experienced, somebody who's very anxious, or somebody who has experienced trauma, what happens is that your body has a physiological reaction to help you survive, right? So when you are experiencing a traumatic situation, or you're experiencing a situation that's making you very anxious, your brain encodes that as a signal that you are in danger. And as a result of that, your brain will set these physiological mechanisms in your body to allow you to survive, which is to either run away from the situation or to fight. Right. And so in those instances, when that physiological kind of mechanism is set on by your brain, it was trying to protect you and give you the ability to survive. What happens is that your prefrontal cortex is shut down. So if you think about it, back in the caveman days, if, as you can see in the picture, if, you had a wolf or you had a bear coming at you, you're not going to start thinking, what should I do? Should I run? No, you're going to either run or you're going to fight the bear. And so it's the same thing. So your ability to think is shut down because your brain is thinking like this person needs to run or fight. And so we need to send the blood to, your heart needs to beat faster so that the blood can go into your muscles and you can run or you can fight. But as a result of that, your executive functioning is shut down. Executive functioning means what? Your ability to plan, to organize, to focus, to think through, your ability to self-regulate is shut down. So if you think about that kid that's traumatized, their brain is constantly getting a signal that nothing is, nothing is safe. Everywhere, everything is danger constantly. And so when they are in school, their executive functioning is constantly shut down. And so they are unable to focus. They are agitated, like I was saying, kind of like your flight or fight response is on. Your heart is beating fast. You're quick to you're in survival mode. That's why you can have kids who engage in fights easily, or who are crying or agitated and things like that. So again, to provide context to further understand that. So I'm not going to go over this table. So it's the same thing that I've said before. You will have that for, since we'll be sharing the PowerPoints with you, just kind of like I wanted to put it into different categories, the different behavioral manifestations of the 3 pillars of trauma. And very quickly here as well, you have what does trauma does. It shatters your sense of safety. Like I said, shatter your sense of trust in others, shatters even your own self-esteem. A lot of people who have experienced trauma can feel a lot of guilt. It can feel like everything is their fault, a lot of self-doubt, and it also shatters your self-control and power. And I want to, really highlight those things in terms of for you to understand kind of where you can be helpful in terms of recognizing kids who could be vulnerable to a diagnosis such as PTSD, and also how to further support them. Another thing too, in terms of trauma symptoms, is the physical manifestation of, the symptoms of trauma can be translated into physical manifestation in terms of a kid's, frequently complaining of headaches and stomach aches, which in a school system would be the kid who frequently visit the nurses. So that's another warning sign. Now, what can we do? So of course, this is a very short presentation. I'm going to try as best as I can to give you little, strategies and things. I'm just really scratching the surface. So there is research that have been done that have proven that trauma-informed strategies in the classroom have been effective in supporting kids and recognizing kids who might be vulnerable to PTSD, but also supporting kids who may have experienced trauma in their life. So there are 5 components of trauma-informed classroom: safety, choice, empowerment, collaboration, and trustworthiness. First one, safety. So as I was saying before, trauma, the person who experiences trauma, especially through this pandemic, through the racial unrest, and all the other trauma that kids may have experienced pre-pandemic as well. Like I said, their sense of safety is shattered. So what can we do as coaches, as parents, as mental health clinicians, as teachers, is to provide a sense of safety to this, to all students, as a matter of fact. And so how can we do that? Is providing routine, structure, consistency. If, let's say, those of you who are teaching or those of you who are coaches, it's kind of like having a same routine. And if the routine or the structure changes, really giving a warning of an upcoming transition or an upcoming change in the structure or routine in advance. So for example, like if in a classroom, you're going to shut the lights off, for example, which seems pretty normal, right? But for a kid who shutting the light off triggers like, oh, this reminds me of when my parents are going to abuse me or something like that, that's going to trigger them. So we have to pay attention to all these little things that if we need to give them warnings like, oh, I'm about to shut the light off, or I'm about to make a loud sound. All these things can trigger kids who have been traumatized. And making sure that if you are, either on the field, the soccer field, or whatever sports field, or in the classroom, that every rule that there are very clear rules and guidelines that every student follows, and that you make sure that students adhere to the rules, because that will convey to the other students that, we are safe in this classroom. We have an adult who makes sure that the rules are being adhered to. Avoiding yelling, but rather use a firm tone. Avoid touching. And this one can be really difficult because we are humans and we're kind of drawn to touch as a sign of rapport building and things like that. But we need to be very careful because touching can also be a trigger. Trying to provide, being very clear and consistent with information, creating areas of calm and comfort. The second one is choice. Choice is, and it's more in the classroom because I'm not a coach and I'm not the most athletic person. I don't know how it would translate, on the field, but basically it's like making sure that you involve the child in what is going on, meaning that, there are some, I'm going to use as an example, the classroom. If, a teacher says, okay, we're going to read this book, but this particular book, let's say for ELA, this particular book, there's a sensitive topic of domestic violence or somebody dying of cancer. Because we don't know sometimes all of our kids and what they have been through, some of these topics could trigger their own trauma. So we have to make sure that if we're assigning something, especially if we think that the topic could trigger somebody, that they're giving an alternative assignment or they're giving advance notice about the topic of the book. Also, giving students options for where they want to sit in the classroom or where they want to be on the field and things like that. Because sometimes too, you never know, like a particular position where they are seated in the classroom or with whom can also trigger them. So giving them a lot of choices is very important. Empowerment is also very important. It's, really amplifying the students' voices, giving them space to speak, for their voices to be heard, giving them the opportunity, I should say, to be seen, to be validated, and it's this opportunity to empower them, to show that you believe in them, so to praise them, to recognize their potential and to encourage the development of their potential and to accept the students as they are, because the more you can accept or the students recognizes like, wow, this person really accepts me as I am, the more comfortable they're going to feel revealing their true selves and the more safe they're going to feel as well. And the more they're going to trust the adult. Collaboration is very important as well. Making the students feel like they have, again, power, their voices are being heard by really involving them in some decision making. So collaborating with the students in their learning, collaborating on decisions regarding class or assignments, although I recognize it's not always possible, but in areas where it is possible, try to solicit their input and collaborate with them. Trustworthiness is very important. Like I said, trauma really shatters the sense of safety and trust. And so it's very important for any adult working with kids to really spend a good amount of time building rapport and establishing, trust with the child. So in the classroom, it could be a teacher taking, and I know it's not always easy, but it's so important, taking 5 to 10 minutes every morning to check in, talk to the kids, get to know them, get to know who they are, their hobbies, their interests, because that's going to go a long way in terms of the children trusting you, and maybe one day even being able to tell you, hey, this is what's going on, I need help, so that you can help them or refer them to the right sources of support. And then it's also recommended this is more for the classroom, like giving them prompts, giving them redirection, bringing large tasks into smaller, manageable portion. Again, because like I said, trauma really compromises your executive functioning. So the more you can deliver the information in a concrete, simple manner, giving it in small chunks, the better, because their ability to process information is a little bit compromised. Other thing, looking at the time. So other things are that are very important, more in the context of the classroom, but we can also do that outside in the field, is making sure that you provide a space. You really indicate to the students, like, there is a space for you, that if you feel overwhelmed, if you feel you're having a hard time, here's a little space. And you create a space somewhere in the field, in the classroom, whatever, where they have access to coping skills or coping tools. And it could be they have a journal, or they have coloring books to suit them, or they have, like a stress ball somewhere, like you can communicate to them that I recognize that sometimes you may have a hard time, whoever it is. You can go to this corner and do what you need to do to calm your whole being down so that you can resume, the classroom or the athletic activity. Also, at Boston Latin School, for example, we've created this system that if kids feel overwhelmed, especially those kids who are prone to manifest their trauma into or anxiety into panic attacks, and they feel very self-conscious, then we create a laminated pass for them. So there's this nonverbal communication system, and when they flag that laminated pass, the teacher knows, oh wow, this student needs to maybe go to the bathroom, take some deep breath, or go see the nurse, or go see a mental health clinician. So that's always available. The other thing I'm going to say about this is just kind of like, also when I was telling you in terms of the flight or flight response, and the kid who's traumatized is constantly in the fight or flight mode, in terms of like they're constantly breathing very fast, they're very agitated, they have sweaty palms, your brain stem system, which is responsible for breathing, eating, and all of that, is dysregulated with trauma. And they say, like, before you even try to help the kid process and resolve their trauma in therapy, what's really helpful is regulating their nervous system, regulating their brain. And that is done through mindfulness exercises, deep breathing, and things like that. And so very quickly here, and you guys will have these slides, but, just to engage or even teach and coach the students, or even like if you are a teacher, or if you have a coach, starting the training session, the practice session with like a 5-minute deep breathing exercise, or ending the session with a deep breathing exercise as well. And here you just have like some instructions on how to do deep breathing. And for our teenagers or even our younger children, there are also great meditation, deep breathing apps that they can use on their cell phone. Like you see the one that are bolded on this slide: Calm, Headspace, breath work, and things like that. And the little picture there, you also see another instruction for a deep breathing exercise. Other things that help, stimulate your senses with stimuli that brings you joy and happiness. Here I put a picture of, I love water. Water really brings me joy and is very therapeutic and calming to me. And this is a picture I took in Winthrop Beach. And I thought it was beautiful, but every time I look at it, it makes me happy. So that's another thing too, to soothe your nervous system. Another mindfulness technique is naming, ask the kid kind of like, can you name 3 things you see, 3 things you smell, 3 things you hear, 3 things you feel, or touch. And this is, again, mindfulness is about being in the moment. If you're in the moment, then it distracts you from everything that stresses you out. It grounds you. So that's another possible technique. Just overall, kind of like if you're worried about a student, observe the, changes in behavior, those warning signs that I was telling you about in terms of possible symptoms of trauma, who raised the concern, what was the context, other relevant details, communicate closely with colleagues, it could be your assistant coach, communicate with other adults that work with that kid as well. And, if you really feel like, wow, I think this kid might be very vulnerable to depression, anxiety, or whatever it is then to refer them, depending on your organization, refer them to a mental health clinician. You're certainly not, if you're not a mental health clinician, expected to treat a student, but definitely to be able to be on the front lines to recognize that a kid could be at risk of, these mental health disorders, and definitely guide and refer these students to the right supports. And so, yes, I think that's it for me. In my slide, just wanted to let you know that in light of the racial unrest, like what's also very important, what has been very triggering for a lot of our youth of color, especially our Black and brown kids, is feeling like the world does not value them, feeling that their race and their ethnicity doesn't matter. And so activities to promote their racial and ethnic identity is very, very important. So I'm not going to go through it because we're out of time, but it's certainly on these slides. I have a couple of ideas in terms of activities to promote positive racial and ethnic identity in youth of color. And also research shows that the more positive youth of color's racial and ethnic identity is, the more they perform well academically, and it also is correlated with positive mental health outcomes.
Thank you, Dr. Prosper. And I also want to thank Dr. St. Louis for such a wonderful presentation. And just to add a few thoughts while we transition to questions that are specific to the sport context and the coaching environment, is that many of us coaches or those who are working in the sports space are doing so many of these things, and we're just innately in tune to what our youth need, but we perhaps haven't been provided this clinical training. So to sort of boil down what we've gone over for an hour, just also want to highlight the importance of coach regulation, and that before you launch into the strategies that Dr. Prosper and Dr. St. Louis went through, to make sure that you do self-care and to make sure that you, as the coach and the medium for these delivery of these interventions, are in a good place yourself. And then to perhaps go through all these materials and make a strategy for your individual players and then also for your team. And if you are in charge of a youth development organization or a youth sports organization, try to infiltrate your organization with all of these resources and strategies to impact many more youth lives and families. So I invite questions. But as we look for questions, I do have a question to pose to Dr. St. Louis and Dr. Prosper. You all shared so much helpful information, but wanted to ask if you could provide one or two strategies that people could start with if this is all new information to them. And we can start with Dr. St. Louis.
So as Dr. Prosper mentioned, first and foremost is the need to provide safety, to provide a safe space where young people can feel heard, can feel validated, but to do so not with a lot of pressure for them to talk. So to just be present. And let them know that you are there to listen when they are ready to talk. So I would say for, especially for colleagues who may not have a mental health background, you don't have to be a mental health provider to do that, right? To let young people know that you are there, and when they're ready, you will be there to listen and support them.
I would echo what Dr. St. Louis said. Most definitely. And then like I was saying, like rapport building is very important. So taking the time to talk to your students, to get to know them is going to go a long way, because because they're going to feel important, because wow, okay, this adult's taking the time to get to know me, to ask me questions, and they are going to start trusting you, because unless you've established that trust, they're not going to come to you and let you know anything. So you won't be able to help them really. And so the more you allow them the space to be able to talk to you and to be able to share a little bit or a lot of themselves, the more they're going to reveal their true selves, and then you're going to be able to help them.
Yeah, thank you.
And I would also add how important it is for young people to know that the adults in their lives are there for them to turn to, and that they will be non-judgmental. So to have a non-judgmental stance and to really be accepting of the young person, however they present, because it's important to keep in mind that they are struggling to make sense of something that they cannot make sense of. So if they're present in a way that seems disorganized or that seems disconnected, it's just the way of trying to make sense of an incomprehensible event. So it's important to be non-judgmental and to be accepting while providing that safe and supportive environment for them.
Mm-hmm. Yes, I would definitely agree with that. One thing that I forgot to mention, like the trauma symptoms, oftentimes, like I say, can be misinterpreted as the kid being aggressive and violent and not focusing, not interested, but these are normal reaction to something that is abnormal. Like it's abnormal what's happening right now with COVID-19, and the racial unrest is abnormal. So it makes sense, and it is normal then to react in those ways.
Thank you both. And for those who are on the webinar who have a background in clinical work or additional training in trauma, do you have any tips for addressing the racial unrest in, say, a group therapy session? Dr. Prosper, do you want to talk?
Yes, sorry. So can you repeat the question? Because I don't think I...
Yeah, sure. So there are some folks that are on the webinar who have clinical training or advanced trauma training, and just wondering if you have any thoughts or guidance on talking to youth, perhaps in a group therapy session or via telehealth, about the racial unrest that's going on right now.
Yes, I think in a group therapy session, it's definitely kind of opening it up. So what I would say at first is just kind of like asking them, like, what are their thoughts? What are their feelings? Just so I can gauge like where they're at. And I think the other thing that's also important, we're thinking about kind of like trauma-informed work, is really like that, like the more you can give them like concrete information about what is going on, because of course it's very confusing, it's very scary, all of everything that's been happening with this racial unrest. So I would say first, ask them about how it makes them feel, but also normalizing that it's a normal reaction that they're having to something that is abnormal. And also stressing the fact that racism is traumatic, and that situations like that really will trigger our own, especially for us people of color, our own memories of microaggressions that we've experienced, of discrimination that we have experienced. So really kind of like saying that it's like it is, a normal reaction to something that is abnormal, especially in the context of a group. What I would say is then let them share kind of like also experiences with racism, microaggressions that they have had. I have done a focus group with our Black and Brown students at BLS, and that's what we did, kind of opening it up. And then through all the students sharing with one another, that makes each student feel like they're not alone, but also they can share kind of like strategies with like, hey, how did you deal with microaggressions? And this is where I could intervene. Let's say if they don't have any ideas, helping them brainstorm, but also I can help them come up with different ways. And I think so it's a great way. You do a little bit of everything. So giving them space to talk and amplifying their voices, especially I'm sure they have a lot of frustrations, a lot of feelings about it, normalizing their feelings, and then engaging them in a discussion on what do they have power to do, which is like how they respond to moving forward, how they respond to discrimination and microaggressions, but also how can they impact change as well.
And Dr. St. Louis, do you have any thoughts to add?
What I would add also is the importance of the clinicians doing their own work, because engaging in conversations about racism, discrimination can be very difficult and can be very uncomfortable. So my recommendation, in addition to what Dr. Prosper has already shared, is that we have to make sure that the leaders of these conversations have done their own internal work of challenging their own biases and being comfortable with having uncomfortable conversations. Because if they themselves have not done the work, it's going to be twice as challenging for them to facilitate open, honest conversations with these young people. So this is the reason why we have created a set of resources. And I know Dr. Prosper shared the link to the resource hub on our webpage, in terms of having resources specifically for clinicians from culturally diverse backgrounds, but also for white clinicians, in terms of how do you talk about race and how do you take ownership for the many ways your power, your privilege may be contributing to what's happening systemically in our society. So it's important, that would be my advice for specifically white clinicians, to ensure that before they engage Black and brown youth around these conversations, that they are prepared for the challenges that are certainly inherent but important in having these open and honest conversations.
Yeah, thank you so much for saying that. And as a white clinician, I sincerely appreciate you saying that and challenging myself and my colleagues to that deep work that needs to happen. So I have a question here from Albert. Thank you, Albert. How can we go about helping to keep colleagues aware of how their implicit biases may have an impact on children displaying traumatic symptoms in the midst of this racial unrest we are seeing in society? Dr. Prosper, do you want to take it first from a practical standpoint?
Yes, because I'm trying to think how to keep so the question is like how to keep his colleagues aware of their implicit biases and the impact of their implicit biases in terms of maybe triggering or further exacerbating the kid's traumatic symptoms, something like that.
Yeah,
just want to get the question right.
Yeah, I think I was understanding it as twofold: is colleague awareness of implicit biases, and then the impact upon children.
Yes. So that's, I think it's a tough one, because I think in terms of the thing is in this, in this climate, there's definitely a lot of talk about, how to be an anti-racist, right? And it's really kind of like, I think one of the ways I think aside from a training, right? Wherever you're working, I think it's really important to, especially in the fall, I think we're going to see a lot of that, like a lot of training about being more aware of your implicit bias, and as well as the impact of implicit bias on, the students that you work with, if you're a teacher or if you're a coach or whatever it is. But I also think that it is our responsibility, if we are observing our colleagues doing something and we know or we feel that they are working from an implicit bias space, to have a conversation with them about it. So that, because sometimes, as you know, they're unaware. So it's like making them aware with concrete examples, and sometimes, like, for example, with microaggressions can be very unconscious, right? But it's coming from a place of what you have internalized about negative stereotypes about people from different racial groups or ethnic groups. And then here you are, you're doing something, you're not aware that it's a microaggressions, but then I feel like as a colleague, you have to educate your coworker in terms of like, hey, these are the reasons this is not right. And in terms of the impact it can have on students, explaining again, kind of like, what does research show about like that racism is traumatic and can lead to PTSD symptoms, just like experiencing a natural disaster or a pandemic of COVID-19. And that there's a lot of research showing that, racism is correlated with not only physical health issues, but also mental health issues. And especially in this racial unrest, like I said before, kids being confused, being scared to go outside, or feeling startled, when they see a white person, those are real. And through microaggressions, which is really the manifestation of implicit bias, it's really triggering that child again. So I think it's education in a workshop, but also if you are a colleague that can observe these things, is calling out your colleague and educating them.
Absolutely. And Dr. St. Louis, any other thoughts?
Sure. So I think that's a wonderful question that the participant has asked, because it strikes at the core of what we highlighted in terms of the contributing factors to significant disparities in this field, right? And the fact that we all have implicit biases, whether you're white, black, brown, we all bring, our own sets of prejudices to the work that we do. So it is important for any of us who is sort of intentional in engaging in this process, that we remain aware of the three domains that are critical in changing our implicit biases. The first is awareness, which means that there has to be a recognition that we as human beings do have certain biases and prejudices, and to be aware of the fact that these biases have significantly contributed to what we are seeing in terms of access and utilization of mental health services among people of color. So the second piece is, in addition to the knowledge, to awareness, it's knowledge. What are you doing about it? Once you become aware that the way in which you think, consciously or unconsciously, can influence your work, how do you go about changing the way in which you engage, learning more, as Dr. Prosper was mentioning, by participating in training, in evidence-based trainings that have been shown to bring greater awareness, right? To bring these implicit biases to a more conscious level. And then the third is skills, because this is a lifelong journey when it comes for us to become culturally competent, culturally aware, culturally responsive practitioners. It's a lifelong journey. So what are we doing to acquire the skill sets so that we can discontinue the practices that can have negative impacts on how we treat individuals of color? So those would be the domains that I would encourage any clinicians to really be actively engaged in: promoting awareness, seeking consultation, seeking training, and acquiring the skill sets so that they can be more effective in addressing disparities among communities of color.
Thank you for that very comprehensive answer. Looks like we have one last question as we wrap up here today. It says, what are some tips/ways that clinicians can best support teachers or coaches who may not be entirely open to putting trauma-informed supports in place, either in the classroom or on the field? And I'm happy to speak to this either after both of you address it, or chime in throughout, but Dr. St. Louis, do you want to start us off?
I think first and foremost, it starts with a conversation, right? I would want to hear where these teachers and coaches coming from, right? What is their experience? So what are their values pertaining to mental health? Because I am of the mindset that anyone who has committed their career to caring for youth, or to caring, especially for youth from urban communities, would not care about their mental well-being, right? So I would want to engage in a conversation, and I would come at it from a non-judgmental stance, not from a standpoint of beating them over the head with why mental health services are important, right? But to learn, to listen, to learn from them, and to begin the conversation around how can we best assist our students, our youth? How can we collaborate as a community? Because it takes a village, right? It takes a village to help to raise healthy children. So my approach would be first and foremost to hear from them, and more often than not, what I've also come across is the fact that there's a lot of stigma, right, that's tied to mental health. And sometimes providers who are hesitant to refer youth for mental health services, it may be because of the stigmatizing view that they have about mental health. It may be that negative experience that they've had, when seeking mental health services. So for me, it's all about problem solving, strategizing, and better understanding so that we can come at it from a point where we can work collaboratively to support our young people.
Thank you. Dr. Prosper, do you have any other thoughts?
I would definitely echo what Dr. St. Louis said. I think what I would add is also, in addition to that, like, so as Dr. St. Louis said, like kind of like asking question, hearing their thoughts. I would want to know more like what's the hesitation, right? And then trying to educate them about why this is important. Because sometimes maybe they're like, oh, why, this is more work to do. Like, why do we have to do that? And just really educating them and clarifying why it's important, but also further clarifying like what's their hesitation. And maybe they have some stigma, and just kind of addressing, all of the possible misinformation they may have that is contributing to their hesitation in implementing trauma-informed strategies. And also, if it's like, for them, it's like, oh my God, it's too time consuming, I don't even know how to go about this, is really brainstorming with them, as Dr. St. Louis said, brainstorming, strategizing, problem solving, and even being like, how can we collaborate together? How can we make your work easier? If, once they're open to implementing these strategies in the classroom.
Yeah.
If I also may, Dr. Prosper made me remember another piece of this. It's the fact that we are not asking coaches, teachers, faith-based leaders to be mental health providers, right? And what we are asking them to do is to be aware, right? To be like the ear on the ground, the eyes and ears, and to see. So if you see something, say something. Connect the youth to the appropriate service. You don't have to fix the problem. If you feel that you don't have sort of the training, the skill set, that is not your job. You have so much more you're doing in your roles as coaches and teachers, etc. But what we're asking for you, because you have a connection with the youth, you are in a position to pay attention to what's different, right, about these young people. So if you see it, say something. Just don't neglect it, because that's oftentimes what happens. Many young people do not get the services. They don't get connected to mental health providers because whoever's in their circle may not have been aware, may not have known about, what was it that I was supposed to look for in order to link them to appropriate services. So if you listen and learn and link, that is all the work that we are asking of you.
Yeah, this has been so well said. And just to add, because this is a lot of the work that Doc Wayne does right now, but a little bit about my background is that I was a college women's soccer coach and wanted to become a clinician, really to be a better coach. So ultimately, these skills that we're all talking about are relationship-centric skills, and coaches are relationship builders, and they're the master of relationships. They just use them in a different way than teachers or clinicians do. So I think just talking their language, and as Dr. Prosper and Dr. St. Louis said so eloquently, listening and learning and asking questions and really understanding where they're coming from. But one of the things that I found to be the most helpful is trying to link mental health with on and off field performance when talking to coaches. So when you have an athlete who's really suffering from mental health concerns, they actually aren't going to perform well in the field. So we need to use those techniques that are really ultimately going to bolster their mental health, but also help them be the best possible person that they can be. And everything will really come together in terms of their athletic performance, their academic performance, their relationships with their family and their supports and their caregivers. It really is one big puzzle, and they're not separate conversations. And so just trying to get the coaching language across, and also telling them exactly what Dr. St. Louis is saying, is that you don't need to be a clinician, and you actually don't need to sound like one either. That's the other big hesitation from coaches and community leaders is, I don't really want to talk about mindfulness all the time. Is that all right? And it's totally fine. Like, there's a lot of sport-based language that you can use that actually gets across the same concepts and teaches the same skills. And if you need that language, please contact me at support@docwayne.org. Happy to share that. But this is all possible, and this is all for the betterment of our youth and our communities. So we're really all on the same team, to use a huge cliche in the sports world. But that's really all for us today. And I just want to appreciate Dr. St. Louis and Dr. Prosper for sharing their great expertise with us today, and also for our attendees and their participation in the chat, and for sending such thoughtful questions to us. And just to wrap up, this webinar is part of our Champions Network, and you can find the recording on YouTube, and the handle for that is DocWayneDTG. But again, you'll get a follow-up email with this recording, with the decks from Dr. Prosper and Dr. St. Louis, as well as the resources that they've added on. And they've taken so much time to really consider what's helpful. So I'm just really grateful for them. And one more time, if you need us or need to contact us for mental health concerns, telehealth, or just general questions about this webinar, our contact information is support@docwayne.org. And I hope you stay healthy and happy during this really challenging time. Take care. Bye-bye.
Thank you. Thank you for having us.
Thank you.